I suppose that we'll go ahead and get started. Like we were saying, this is being recorded. Therefore, we will go ahead and give our presentation and have everything available to view at the website for the Epilepsy Awareness Day. And so, first of all, I'd like to thank the organizers for inviting us to give a presentation. And we have, looks like a Mayo Clinic website that we've set up through the Epilepsy Awareness Day. So hopefully you can go there for any further information. But we are representing here Mayo Clinic in Arizona. So we do have a large clinic as well as a hospital in Phoenix and Scottsdale, Arizona. So we have several different locations throughout what we call the Valley. And we do higher tertiary care for epilepsy. We are a level 4 epilepsy center prepared to basically handle whatever epilepsy needs come to us with quite advanced capabilities. But what we are going to do this evening to kind of showcase just one of our facets of our epilepsy care at Mayo Clinic in Arizona that we believe is unique, and we're not sure if anybody else is doing this, is what we call our Transition Readiness Program, Transition Readiness Clinic. And what we've been able to do is partner with our internal medicine pediatrics primary care group, represented here by Dr. Kruger. So we've invited her to come help give this presentation tonight. So appreciate you joining us tonight. And the other person who is really spearheads the transition readiness program is Nicole Schuren, our medical social worker. So unfortunately, she's not able to be with us tonight, but does help contribute and really help spearhead this program. And really, I should first define what transition readiness really means, and we're going to talk about that throughout tonight. But transition readiness is really, when we talk about it here, it's getting a patient ready from being a pediatric patient to an adult patient, right? And so Dr. Kruger is an expert at this. She is both trained in both internal medicine and pediatrics, and therefore I'm gonna advance the slide. So feel free to just tell me. But we'll have Dr. Kruger go ahead and kind of introduce this topic to us.
Thank you so much, Dr. Hoerth, and thank you all for being here. I am thrilled to have the opportunity to be part of Epilepsy Awareness Day. And really, it's been an honor to be part of the Transition Clinic and learning about epilepsy myself and how it affects patients and families, as we have really in our work in the Transition Clinic over the past 2 years. So one more thing, Dr. Kruger, sorry to interrupt you before you get started, but I forgot to mention we have Dr. Katherine Noe here. She is going to be manning our chat box, looking through. She is our division chair, and so anything that comes through the chat box, and she may be helping moderate questions at the end. So didn't want to ignore Dr. Noe here kind of in the background. No, I would second that. And I would also say that I think my goal, I think Dr. Hoerth's goal, Dr. Noe's goal is really to keep this as informative and maybe as informal as people would like to have it. And so if questions come up about what we're doing or about something that's said, please feel free to fire away a question in the chat box. And hopefully if it's not answered in the initial part of the presentation, we're happy to discuss it afterwards. So Dr. Hoerth, maybe if we can go ahead and move to the first slide there. So we might be asking ourselves out of the gate, so what is unique about this population? Why is this a thing? Why are we talking about transition? We know that as young people, as patients start moving out of the truly pediatric time in life and enter into their teenage years and then move through the teenage years and into young adulthood, that's a really unique time for a lot of reasons. It truly is a process. It's a transition time where we're not really fully children anymore, and we're not yet fully adults. And there's a lot that is wrapped up in that. We know that there's this concept of emerging independence, right? We go from a time in life when young people are really completely managed by their family and their caretakers. And then at the end of this period, they are completely, or hopefully as close to completely independent as they can be. And so what does that look like? What does that process look like over time? There is this concept of really growth and emerging autonomy and emerging independence. And what we do know is that when we support young people and families through this, that young people are really able to achieve more, that they often are able to become more independent with regards to managing not only their medical needs, but also with their needs in the rest of life, right? And we'll talk a little bit about that tonight, because we recognize that the concept of transition and the idea of transition is certainly important with regards to epilepsy, but also with regards to all the other things in a young person's life outside of epilepsy. We know too that this is a process not only where they are becoming more independent, perhaps with their medical care, but there is also a time when they are becoming more independent with regards to finances, that they are hopefully becoming more independent with regards to education and with regards to career planning and with regards to what they are going to do with regards to life planning and things like that. So this is a pretty critical time. And we know that the better that we can do to support our families and our patients through this time, that the better that they're going to do in the long run as adults. We can do the next slide there. So when we speak about transition and we say, what is transition readiness? It is really a pathway. It is really a process. And it is a concept within medicine that has been around now for probably 30 years, that it was first defined in the medical world in the early 1990s. And it's been talked about and looked at in various ways since that time. It does not mean that once you turn 18, that you're no longer a child and now you're an adult, right? So it's much more than that, and we know that to be the case. It really is a process of preparing young people and their families for the movement from a child-focused, a pediatric-focused model of care into an adult model of care. And we know from having looked at it now for almost 30 years in medicine that it really is best done in a very comprehensive way. It's really best done in a team-based way. And it's really best done when it engages not only the patient, but also the family or the caregivers who have been taking care of that young person during childhood, and engaging all of those parties in this process, in this movement into an adult model of care. And so when we speak about readiness, we are really speaking about how do we assess where a young person is? How do we assess what the needs are? Both their medical needs with regards to the specifics of the epilepsy, but how do we also assess what the other needs are with regards to resources maybe outside of purely medical? What are the needs outside with regards to education? What do we need to do to get that person successful? And so it really is a matter of assessing that, of really taking a hard and fast look at where we are and what we can do to get to where we want to go. And a lot of that involves assessing strengths and then setting some goals and making sure that we are all on the same page with regards to what the young person's goals are, as well as what the goals are for that family, because it's about meshing those two and supporting them through that process. Next slide. So who gets to talk about it is a great question. And really, I would like to say that virtually anybody can talk about it. And one of the reasons that we're here tonight is because we're hoping that after we introduce it, and maybe it's a reintroduction for some who watch this, that more people will talk about it, right? Because really, any young person, any child, any adolescent, any young adult with a chronic medical condition or a disability, any sort of chronic health condition, really should be talking about transition, and really ideally should be talking about transition from an early age. And what I mean by that is 12, 13, 14 years old. There's national guidance on this. There is a .transition website that really looks at this and lays out a nice process that really starts in that 12, 13, 14-year-old range. Now, if you are a young person who's been managing epilepsy since you were 3 and 4 years old, then clearly your parents or your caregivers were doing all of it at that point. But if you're a young person who was diagnosed later, perhaps as a teenager, then hopefully the conversations about what transition looks like starts around the time of diagnosis or shortly thereafter. It can be spoken about at any time in that period, and it's something that can come up in general pediatricians' offices or general family practice offices, and as well as coming up with your pediatric neurologist when you're going in to see them for your epilepsy follow-up. And it can happen with any other specialist. It can happen with just medical providers, and it can also happen with perhaps someone who's not truly a physician or a nurse practitioner or a PA. Dr. Hoerth mentioned tonight that one of the key members of our team who's not here tonight, Nicole, she's a social worker, and her input and assessment is critical. So this is something that whether we are speaking about social work or physicians or nursing or any members of the team, really it's a conversation that can start within any of that. Next slide. So why do we do this then? Why do we pay attention to this? Why do we make this a thing? Why did we start doing this at Mayo, Arizona almost 2 years ago now? And we really do this and did this and are doing this and growing it for a number of reasons. So we know that the more support that we give young people and their families through this period of transition in this process, the better they do with regards to epilepsy management, as well as a whole host of other factors. We know that to be the case. That's been studied and shown. And so we do this to make sure that we are part of that we are supporting patients through that. Part of this is regarding the medical compliance. So yes, we want to make sure that we are doing everything we can to help them take their epilepsy medications, to make sure that we are doing what we can to support them. We know that epilepsy is difficult, and we are committed to trying to help patients and families manage it. We're also committed to looking at all the non-epilepsy sides of life, because we know that for patients who are watching this tonight, there's a lot more to you than just your epilepsy. And so part of what we do in this clinic is to really make sure that we have in place a team to look at the rest of things as well. So we look at independence. So we look, for example, at how independent is a young person at making medical decisions. For example, do you, as a young person with epilepsy, do you request your own refills for medications? Do you know when to take your rescue medicines when you need it? Do you know how to call if you need to reschedule an appointment? Do you know how to reach your doctor if you need something? Because we know that that's a process, and that starts probably with parents, caregivers making all of those decisions, but we have to get to the point where the young person is making all of those decisions. So we assess some of that in our transition readiness clinic. We look not only at how independent a young person is with regards to their medical care, but how about life skills? So do you manage your own bills? Do you know how to keep a checkbook? Do you know how to use your debit card? Things like that, that really can make a difference with regards to how successful a young person is with regards to epilepsy and life in general. We know that the world that you move into when you are graduating out of pediatrics and into the adult world, it looks very different Perhaps, for example, you may be over 18, but maybe your pediatrician's office is still talking to your parents because they always have spoken to your parents, right? We know that when you move to the adult world, they will not be so happy to do that, right? And we know that there are other aspects of care in the adult world that are just different from where they were in the pediatric world. And that's okay. It can be really scary and it can be overwhelming, but the earlier we talk about it and the more that we recognize that it's a thing, the better we can do to support people through that. We also know that as we move into adulthood, that there will come times, challenges, medical challenges that can be really frustrating, especially with regards to independence, especially with regards to how the epilepsy affects my life as a teenager, how it makes me different, how maybe I don't fit in with all of my peers at a time in life when it's really important to fit in. And so part of what we do in the Transition Readiness Clinic is really talk about how do we manage that? What kinds of coping skills do we have? What kind of strategies can we put in place so that we recognize that, yes, I have epilepsy, but it doesn't have to make me feel as different as it might, right? Ultimately, we want to make sure that even though we may have epilepsy, even though we may have whatever else we have going on in life, that we are comfortable and that young people are comfortable with their own ability and capacity to really feel healthy, right? And to make good choices with regards to your own health and well-being. Next slide. So we are speaking here today about epilepsy, but really, if we talk about what conditions should we be seeing in the Transition Readiness Clinic, we can see almost any kind of condition. So we've been doing this at Mayo, Arizona for 2 years with epilepsy, but we know that some of the same themes that we see in epilepsy can really be applied across the spectrum of chronic illness, right? So some of the challenges that we see in transition readiness in this time of life can really apply to anyone with a chronic healthcare need. Anybody who has grown up managing an illness and needs to now move into the adult world and continue to manage that illness. So anything is really fair game. So some examples that we have up here just to think about, so if we need to see an endocrinologist because we have been managing diabetes as a young person, that's going to need to continue to happen in the adult world as well. We have patients with inflammatory bowel disease who are going to be moving from maybe a pediatric GI specialist, and now they're going to need to see an adult GI specialist. We see a lot of young people with chronic mental health needs. If someone has been managing depression and anxiety, and what does that look like as we move into the adult world? Kidney disease, liver disease, cardiac disease, pulmonary disease, virtually any, you name it, and we can benefit from this comprehensive approach, team-based approach, to try and make that transition and that process as successful as possible. Next slide. And Dr. Hoerth, maybe I will pass it back to you if you want to speak a little bit to the specifics of clinic.
Yeah, absolutely. Thank you for laying that foundation. So I'll pick it up from here and just say, okay, what happens in our transition readiness clinic? And I'll emphasize that here at Mayo, Arizona, we are, I guess, what I keep saying, I think is unique because when most people talk about this transitions care, it's mostly the pediatricians talking about this. So coming from a pediatric hospital and getting them ready to enter the adult world. Mayo Clinic Arizona is actually an adult hospital. So we do not have a pediatrics specific practice, right? We have generally an adult practice, right? So Dr. Kruger is one of the several that actually has been trained also in pediatric care. But we primarily see adults. We do kind of say that for coming to come see us, we started about 16 years old. So really the way that our patients get into this epilepsy transition readiness clinic is through the epilepsy specialist. So one of the 5 of us who are the epileptologists will kind of refer into this clinic. And then they come and we kind of set up an appointment for the epileptologist, Dr. Kruger, as our primary care physician, and our medical social worker, Nicole. And we all meet together in one location to have like essentially a combined appointment. What happens from there is then we meet all together as a group, but then we kind of split apart, and the patient then gets kind of focused attention from each of us, separate from their parent or caregiver. And then the parent and caregiver meet separately with each of us. So it kind of in a bit of a round robin fashion. And this gives us an opportunity to kind of hear everybody's needs as a group, but then hear everybody's needs kind of individually. And so that doesn't often or always happen in especially a specialty appointment. I think our primary care colleagues in pediatrics are probably better about, as teenagers come up, they kind of ask the parents to leave. But during a specialty appointment, I know that often doesn't happen. And so this is very intentional in doing so. And when we do this, we kind of very easily can focus in on those needs that are brought up by both the patients and parents, caregivers. And then at the end of the appointment, we kind of come back together and really try to hammer out some very obtainable goals, right? And so an example of something like this would not be like, get a job, right? That's kind of, not that that wouldn't be obtainable, but that's kind of a little bit too broad and too kind of generally focused. So we might, say, okay, well, why don't you first start by developing a resume, and we'll get you into, vocational rehab, something like that, right? A lot of our patients are, again, even younger than getting a job. So things like, why don't you start refilling your own medications or filling your own pill bottles, things like this. We've even dealt with things like, let's get you to actually swallow a pill and not have to take the liquid, right? So things like that are things that we identify that sometimes just get overlooked, previously. So why is this important, and why is this important in epilepsy? And certainly we don't want to minimize other disorders, but anybody listening to this, obviously understands epilepsy and knows what kind of impact it can have on life, right? And so the things that aren't outwardly apparent, a lot of our epilepsy patients, they look and act like everyone else, but they do have this thing that can happen, seizure, right? Out of nowhere. And so what does this do to people? It can make them feel isolated, right? Can make it a little bit more challenging to, stay in school and, continue with classes. Like if seizures are happening, things can be missed. Also work, and a lot of concerns about, even obtaining employment, over time. One thing that we really do see that's a lot more important in the adult population than the pediatrics, and a lot more discussed, is an issue of driving, right? Driving is independence, right? Driving generally means we need to be seizure free. And of course, we always want to go to that goal. But, we do talk about, well, even if we're not seizure free, how do we still, obtain transportation, getting from one place to the other? And these things are very much addressed. Usually the epileptologist is pretty good about talking about these, but we can then do that more in depth and more with resources. We also talk about just even adjustment to the illness, especially new diagnoses, like in teenage years. How do we kind of wrap our head around that and kind of understand how does that affect you as a person, and kind of just moving forward in life instead of having to stop. And so this is why we need to kind of invest into this group as they're trying to develop their own selves and who they are. It actually makes a lot of sense to help guide them along and define those things in the context of their diagnosis. And so who are the best patients? So really we had to make some sort of cutoff and kind of hard stop. And it really does, is there anybody 25 years old and below? Um, to be very transparent about this, the reason why we chose that age is because that is about the time where the parents' insurance does transition off of them, off of the parents, and then the patient needs to have some sort of um, insurance of their own. That is a big step, kind of in maturity, right, and growth, and you know, going towards adulthood. That's almost decided by kind of things beyond us. And those under 25 are generally still in school and still many of them, not all of them, but are kind of still developing. So for here in Mayo, Arizona, we've kind of defined it as 25 years old or less. Certainly transitioning to adulthood can take longer than that. We recognize that, but that's kind of really where that goes, because we had to have some hard cutoffs. We do see patients, I think I may have mentioned this, down to like 16 years old is really what we are able to do in terms of being able to provide other resources and tests and all those sorts of things. So anybody really between 16 and 25 is really where it comes down to. But really, the best people are those who kind of have identifiable needs, right? So it's not always those that they show up to the appointment and they've said nothing to the doctor, and it's always been the parents talking to the physicians the whole time, and then all of a sudden it's like, oh no, I need to kind of do this on my own and to kind of fully transition. It can be those patients who are somewhat self-sufficient also, and that really just need to have us fill in the blanks and find those needs. Sometimes I'll be honest that the parents need the transition appointment more than the patients themselves. I think, yeah, Dr. Kruger is kind of nodding around, because sometimes patients are really ready to go, but parents are not really ready to let them kind of fly on their own. And we do recognize also that there are some patients who may not really be set up for independent living, right? And so we kind of talk about those things as well. There, we do, see a portion of patients who are developmentally delayed, and that goes along with their epilepsy. And there are a lot of things we can kind of discuss around those topics as well. So just to kind of make a side note discussion of that. So really, we'll kind of talk here, I think this is one of the last slides here, about the benefits of transition care in epilepsy, right? What are we seeing in the work we've done so far, and where have we kind of helped, right? And so let me be very honest. As a neurologist, as an epilepsy specialist, I am not a primary care physician. I have not been trained in that. Yes, we do get some basic training throughout our medical school and residency, but we're not great at that. I can't tell you exactly if you're going to be up to date on your immunizations, or if you were to call me and you think you have a urinary tract infection, I may not be the best one to manage that. And so that's where, again, we're so grateful to have Dr. Kruger partner with us to be able to kind of help address those needs. And I will say I've been surprised. I feel like I know my patients pretty well, and they kind of tell me a lot of things, but oftentimes they may be struggling with other medical issues that they just don't want to bother me about during my appointment, and they don't have a primary care doctor, and these have kind of been neglected, right? And so we've identified a lot of different things over time here. The other benefits is that, as I was mentioning before, kind of outlining some clear steps on what needs to happen, and identify, potential gaps. These kind of simple things like, really, you're not putting your pills together yourself. Like, we really need you to do that because you're going to be off in college in 3 months from now. And if you don't know what your pills look like or how to refill them from the pharmacy, let's get those things kind of very clearly laid out. And so it does, like what we've shown is that it does very much help put parents, caregivers at ease, kind of allowing them to kind of go gain independence, but also kind of strengthens the kind of medical compliance and those sorts of things from the patients themselves. And the other main thing is really to connect with resources, and that's where again our social worker Nicole is incredible at providing those resources around them. Now, I'll just side note mention that yes, we are in Arizona. I think we have the most benefit and knowledge around those resources in Arizona and what's provided there. Although we are trying to kind of understand and maybe even think about gathering a bit more resources for the Southwest area, California, Nevada, New Mexico, et cetera, to help those within kind of the area, since we do serve all the Southwest or really wherever we're set up to have patients come from out of state as well. And so we haven't done as much of that yet in this kind of initial phase, but I think we're going to be ready to kind of offer that more widely as a kind of a transitions appointment for even people coming from out of state. So with that, I'll either open things up to questions, or if Dr. Kruger would like to have any other comments. Dr. Noe, any comments?
No, great talk, and I think a great overview of this really unique program. I think, as you said, Dr. Hoerth, for those of us that are passionate about epilepsy and have been doing it for a long time, it's because sometimes you don't know what you're missing until you have it, right? So it's really challenging, and I suspect parents and teens and young adults and adults that are listening to this will recognize how hard it is when we all know what the goal is. The goal is as seizure free as we can get you, but to be independent and to have fantastic quality of life, which is about so much more than what medicine are you on and how many seizures did you have since your last visit. And it's really tough to be the quarterback and put your own team together when it's not there available to you. And actually, for both of you, that's one of the questions I was going to ask that I think might be helpful to our audience. This is such a unique program that you all have put together and that we benefit from and our patients benefit from. But for the person who's listening to this and is like, but I don't have that. I'm trying to make this transition, whether I'm trying to gain independence or I'm trying to help my loved one become independent. For the person who is trying to be the quarterback of their own team, who says, I have a doctor who writes the epilepsy medicine, but I'm missing these other things. Where would you suggest that they go? Or if they need to make a request, what kind of things, if they say, I don't even know what to ask for, what kind of things could they be asking for to help this transition be successful?
So maybe I'll start, Dr. Hoerth, and then I'll feel free to chime in. So one of the things that I would start with saying is that when you move into an adult world, you really need your subspecialists as well as your primary care providers. And sometimes I think, depending on where you are moving, what kind of a pediatric world you've grown up in, right? Sometimes if epilepsy is really the only thing that you've been seeing the doctor for regularly, or the only thing that you and your family have been working with pretty closely with your medical team, there may have been a time when you weren't seeing your regular pediatrician anymore, right? So that we see that a lot, not just with epilepsy, but with a lot of other pediatric conditions. And that has a lot to do with just the culture of pediatrics, which is a little bit different, honestly, than the culture of adult medicine. And anyone who is making that jump kind of can recognize that it feels a little bit different in the pediatric world than it might in the adult world. And what I would say, as someone who is trained as a general pediatrician and trained as an internal medicine doctor, which is like a pediatrician for adults, a general doctor for adults, it is really important in the adult world to have someone, a partner, who can partner with your epilepsy doctors. So if you are finding yourself tonight thinking, well, gosh, I'd really like to do this, but I don't even know where to start. I would start by making sure that you have a primary care doctor, period, number one. And if you don't have one, right, then maybe ask around if you have any friends who have any. If you're in college, and you can ask who your college friends see. If you can ask your epilepsy doctor if they have anybody that they work with, because you want to make sure that you have somebody in the adult world that you can ask about things like what Dr. Hoerth said. If you have a urinary tract infection, or if you think you have a sinus infection, or if you're throwing up someday. Not that Dr. Hoerth and Dr. Noe and your epilepsy doctor don't do that too, but they probably would rather talk more specifically about your epilepsy doctors, about your epilepsy medications, and you really need a primary care doctor that you can run that stuff by. And that's very much normal for myself as a primary care doctor for adults. So step one would be to make sure you have a primary care doctor, because that's going to become really important in the adult world, even if you haven't had one as a kid. The second thing I would say is that there is a lot, like what Dr. Hoerth said earlier, there's a lot that that we do that maybe is outside of what just the doctors do, right? So, and what our social worker, Nicole, does as part of our clinic visit is invaluable to making this successful, right? So, and so I would say, I recognize that most people who are listening here might think, well, gosh, I don't have a social worker. And that's okay, right? So, but once you have a primary care doctor, then I would ask that primary care doctor maybe some questions like, where do I start, right? I'm not sure. I have some questions about college, or I have some questions about whether I can go to college. Who do you recommend that I talk to about those things? And I would ask that primary care doctor to help point you in the right direction, because even if there's not a social worker there that you can ask questions of, your primary care doctor working with your epilepsy doctor should be able to help at least get the process started for you.
Yeah, I'll echo on that. So one of the biggest challenges that I do see with taking care of complex care, including in this age range, is really how do patients even navigate the medical system? Like, who do we ask for what issues? And having the physicians communicate with each other. There have been some suggestions, and again, I don't want to kind of put this burden on people, but having the physicians that take care of you like within the same system can be helpful. I know that's not always something that can be done, but at least like Dr. Kruger was saying, physicians able to understand and communicate with each other. But if it's the patient, the parent that's like trying to quarterback all this, I would just really recommend that you ask the questions, right? And so we've had I've had a good number of patients in college that even say like, what, I can get some help in my classes through the disability office. And I said, yeah, every college has a disability office. Like, they didn't even know to really bring that up to me to say that like this could be something that could help them out, right? And just simple things like a little more time to take tests because their medications may slow them down, right? These things are very reasonable accommodations to make, but they just don't know to ask. So if there's something that any patient's struggling with, I think it's fair game to just bring that up. There may not always be a great answer for that from your physicians, but feel free to ask. And sometimes you'll get answers like, oh, that's a better question for your primary care doctor, or vice versa. Maybe that's a better question for your epileptologist, but at least right? And so I do have a few patients who will even send messages to, well, it's better to send it to one and then the other, and it's okay to, not get that right all the time. So, but don't, say something, ask the question.
That's great. I'm going to ask, a tough question, but I think this is one that we see time and time again in the clinic with, with our transitioning patients, and honestly patients of every age, but particularly acute in this age. And this has to do with fear. So I think as parents, as former children ourselves, we remember that, a lot of part of growing up is parents learning when to give their kids, independence, whether it's dropping them off at kindergarten or letting them ride a bike down the street the first time or have that first sleepover. And obviously in adolescence, those issues really become more acute and more accelerated. When you add, an element of epilepsy to that, even in someone who's been seizure free for a long time, that uncertainty, that fear of what if can become magnified on both parts, the child or the adolescent and the adult, but I'll say particularly for the adults. And obviously this is where mastery is important. We got it. We all want to get to independence. So when we're facing that fear of the what if, any words of wisdom or advice for how families struggling with that, again, so let's say not the primary barrier is, maybe seizures are not totally out of control, but it's really the fear of the what if. How can patients and families be empowered to face that and move forward through the transition to adulthood?
Dr. Noy, that is a tough question. I don't know exactly how to answer it because it may not be one specific plan for everybody, right? What I have recognized is kind of listening to both the parents and the patients. What's interesting is that a lot of times their fears about or surrounding their epilepsy are not the same, right? The parents may worry about, the fears of more like, are they going to remember to take all their medications, right? Where the patient may be more afraid of like, well, what time am I going to take my medications? Because some days I need to sleep in and some days I don't, right? And so there is a lot of different concerns from the patients, a lot of different fears, and what I generally try to do, and again, Dr. Kruger can point this out or have refine this, is that I try to hit those kind of head on, right? If we're very specifically kind of worried about one, or several, specific things, well, why don't we kind of address those things directly? And I try to empower people with knowledge, right? Facts around that, particular concern, and try to, modify the management to kind of address those concerns if need be, right? But knowledge is power, right? So any other thoughts?
Well, I would agree. I think it comes up a lot, and it's probably one of the hardest, just one of the hardest things that we manage. I would second the idea that it comes up and we just have to recognize it and name it, number one, and say, I get it. I totally get it. And one of the advantages that we have at looking at this through two different lenses, we look at it through the adult world and we also look at it through the pediatric world, is to recognize that fear, right? We name it, we know it's there, and we are going to manage it. We're going to deal with it, and we're going to equip you, the young person, the parents of the young person, to feel as comfortable as you possibly can with where we are and what we're doing. It doesn't happen overnight, like what Dr. Hoerth said. This is why you're not getting dropped off at the adult healthcare world. At least you shouldn't get dropped off at the adult healthcare world, right? That this should be something that is talked about in small steps so that the knowledge, like what Dr. Hoerth said, that knowledge is delivered in small doses, right? Because that's how we become more confident in ourselves as the young people living with epilepsy, and as the parents in letting go of something that perhaps they have managed themselves for their child their entire life. right? So, and recognizing that that can become oftentimes your whole life and your whole world. And it's hard to envision what life looks like without that, right? And so we name that, we know that's the case, and then we know that this is a process that we're going to work through. It doesn't happen overnight. Many times, our initial clinic visits, like what Dr. Hoerth was describing, that initial clinic visit is then followed up by visits with Dr. Hoerth and the epilepsy team whenever needed, and then also follow-up visits with myself and whenever that's needed. And we're always checking in to make sure that we are making progress on those small goals to get there. So I think that process, it's baby steps sometimes, right? And then we look back and say, oh, wow, this is not so scary anymore because I've been taking it step by step for now. And I have a team of people who can help me, right? And I think that parents and patients, but particularly parents, really want to feel like they have people they can call, right? Just like if you're a parent, you knew your pediatrician, you could call them whenever you had a question. You want to feel that same way as your young person, as your child is moving into adulthood. And I really do think that if we can build that team, that helps to dispel some of the fear and helps to build the confidence.
Great. So I have, I'll throw one more question out there, because I think it's a common one. Obviously we're so fortunate at Mayo Clinic in Arizona to have this transitions program where we kind of receive and build our patients into an independent adult practice. And a small number of people are lucky enough that their pediatrician or their pediatric neurologist may be able to work with them on transition readiness. But I suspect, most people with epilepsy out there, and most of our listeners are probably not so fortunate. And I think one of the scary things in transitioning to adulthood is essentially you have to break up with the pediatric neurologist or pediatrician who has been your close partner in the fight against epilepsy, for some period of time, and step into the unknown. So, obviously there are lots of pressures, that might force somebody, they age out of practice or insurance changes, or they go to college or they move, that they have to find an adult doctor. But when you think about somebody in that age group where they're kind of, they have some options about, do I stay with my pediatrician or do I move to an adult practice? Are there any particular challenges that you would see would kind of be a trigger or a flag that this is probably time to move on to an adult team?
So I can start here. So I think that I think that sometimes in the world of pediatric medicine, sometimes we don't bring this up as early as potentially we should, right? So because we, as pediatricians, as pediatric epilepsy providers, have that close relationship. We love our patients. We love the patient's parents. We've seen them through a lot in life. And so sometimes, honestly, and I can say this with my pediatric hat on, we're not always very good at letting go, and we're not always really good at launching them, right? So perhaps as parents, perhaps as pediatricians, what have you. So I actually think that if you are, certainly by the time, if you're coming through your teenage years, but certainly by the time you are a senior in high school and you are approaching the age of 18, if your pediatrician or your pediatric epileptologist has not discussed this with you, I would ask them flat out. I would bring it up and I would say, hey, what happens when I turn 18? Do I get kicked out of your office? Do I keep coming to see you? What happens like that? Now, they may not have a very clear answer, right? So sometimes it depends, like what you said, Dr. Noe, there's a lot of factors that play into that. But I would not be afraid to bring it up and to ask, because we know that it's a process, right? So, and I think that every practice situation is a little bit different. I see a lot of late teenagers who, by the time they get to be in their later part of high school and then they're in college, they're no longer as comfortable sitting in the waiting room next to the younger kid, and they probably don't even fit on the exam table anyway, right? Those kinds of things. So if you're hitting that time in life, then I also think it's fine for you to say, hey, is there a time that I should really be thinking about transition, what does that look like, right? So, and I would encourage you and empower you as the patient with epilepsy to ask, because if you're a pediatrician, and like I said, sometimes we are as pediatric providers a little reticent to push people along because we love you all as patients. I would say from the patient perspective, don't be afraid to ask and to say, hey, I want to get going. I want to really make sure that I'm ready for this. So can we start talking about it?
Great. Well, that's wonderful. I want to say thanks to both of you for all the work that you do to care for our fabulous patients. Thanks to everyone who's listening. I appreciate you empowering yourself and educating yourself, not just through this talk, but through all the activities of the day. And thank you so much. This has been a wonderful opportunity to hear more about the program. Dr. Hoerth, Dr. Kruger, any final comments as we wrap it up?
I would say no, just appreciate everybody for joining us. I mean, I did leave some resources here. I think there are some on that other website. We are taking appointments. Again, we have this kind of 16 years old and up, general guidelines on that. But if you do need extra help, especially if you live in the Southwest, happy to help. We have our other campuses in Jacksonville as well as in Rochester. And if you do truly need a truly need a pediatric appointment, we do have a full pediatrics hospital in our Rochester campus at Mayo Clinic up there in Minnesota. So appreciate everything. And if there's no other comments or anything like that, we'll go ahead and close the session and make this available for those who may want to pick that up in the recording. But thank you, everybody, and glad that we're able to participate in this Epilepsy Awareness Day. So thank you.